আসসালামু আলাইকুম। আহ, সবাইকে স্বাগত জানাচ্ছি আমাদের আজকের অনুষ্ঠানে। আহ, আমি সাবরিন, মেন্টাল হেলথ কাউন্সিলর। সবাইকে স্বাগত জানাচ্ছি আমাদের আজকের স্পেশাল প্রোগ্রাম রেডিও আমার 88.4 FM প্রেজেন্টস। এবং আজকে আপনারা দেখতেই পাচ্ছেন আমাদের কি টপিকে আমরা কথা বলবো, আর আমরা সেটা পোস্ট অলরেডি দিয়ে দিয়েছি। বাট আজকে আমরা একটু আমাদের প্রোগ্রামটা উইল কন্ডাক্ট আওয়ার প্রোগ্রাম ইন ইংলিশ, অ্যাজ আমাদের সাথে একজন স্পেশালিস্ট আছেন যিনি একজন ইন্টারন্যাশনাল ফিগার। সো আমাদের পুরো প্রোগ্রামটা আমি একটু ইংলিশে কথা বলবো। আর আপনাদের যদি কোনো প্রশ্ন থাকে আপনারা এখানে সরাসরি কমেন্ট করে আমাদের সঙ্গে যুক্ত হতে পারেন আজকের টপিক রিলেটেড প্রশ্ন থাকলে। আহ, এবং আপনারা এখানে কমেন্টও করতে পারেন, এবং যদি কোনো কিছু জানার থাকে আজকে টপিক রিলেটেড, দেন আমি অবশ্যই সেটা আমাদের যিনি স্পেশালিস্ট আছেন তার কাছে পৌঁছে দেওয়ার চেষ্টা করবো, এবং প্রয়োজনীয় পরামর্শ আপনাদের কাছে পৌঁছে দেওয়ার চেষ্টা করব। তো সবাইকে স্বাগত জানাচ্ছি আমাদের আজকের প্রোগ্রামে। আশা করছি সবাই আমাকে দেখতে এবং শুনতে পাচ্ছেন। So, what we are talking about today, breaking the taboo around addiction and road to recovery. So, everyone knows someone who has struggled with addiction. Many have perhaps struggled to weed themselves. Some people get out of it, some never do. In our society, there are lots of misconceptions, myths about addiction and or substance abuse. Whether you realize it or not, you are seeing and hearing a lot of things about substances that just are not true. So, for instance, movies and TV sometimes make smoking look like a cool thing to do, but often tobacco companies are paying the show's producers to show smoking that way so that tobacco companies can get into your head and into your pocket. So, other times you are not told some of the most important things about drugs or substance. One example, did you know that all drugs affects our brain? Different drugs do different things to the brain, but they all mess with its wiring and signals. So, and depending on when you start using a drug, the effects can last a long time, in some cases for whole life. So today we have designed our program to discuss about the myths and misconception about drugs, substance, or around addiction, and how it affects our brain, our nervous system, and the ways to recovery. So let's talk about it. Let's shatter the myths and know the paths of recovery. Before starting the program, I would like to play a short video. Coming back shortly. So, welcome back to our special show. Radio Aamar 8.4 FM presents Breaking the Taboo Around Addiction and Road to Recovery. So, in this short video, we have wanted to show you how an international de-addiction treatment center is working. So, in this program, we will let you know how an international de-addiction treatment center is working and making changes. In association with Athena Times, we have arranged this program and me, Sabre, mental health counselor, again welcoming all of you in our show. And for this discussion, we have invited today Dr. Prem Kumar Shanmugam, CEO and Clinical Director of Solace Asia, Malaysia. Sir, how are you? Welcome to our
Hi,
show.
Sabrin. Thank you very
Hi.
much. I'm very well, thank you. And how are you?
Yeah, I'm fine too. Thank you so much for joining with us. Uh, so, sir, first of all, I wanted to know what is addiction and when we will address a person as he is addicted.
Okay. Thank you very much for having me on this show. I think that's a question that many people ask. When is it that I'm addicted? Okay. The easiest answer to that would be addiction is something where your life becomes unmanageable. Okay. For example, people drink alcohol, right? Some people drink alcohol, but some people cannot drink. When they start to drink, they cannot stop. So when that happens, the life becomes unmanageable, and because of that, they have an addiction. That's a simple answer. But if you want to look at it from a clinical perspective, there are a few ways to define. First is what we call use. So I use substances. Then there's something called abuse. I abuse the substances. For example, if I go and see the doctor gives me a medication, I need to use it. Once I use it more than the prescription, it becomes abuse. After abuse, the next stage is called dependence or addiction. The abuse becomes so bad that I'm addicted to it and I need it to function. That's what addiction is, in simple terms.
Oh, thank you so much. There are lots of myths about addiction, about drug and alcohol. Some people say I can drink and still be in control. Some used to say
Mm,
cannabis or marijuana is not addictive, or
mm,
drinking is not all that dangerous, or I
yeah,
can manage to drive well enough after a few drinks. So
mm,
lots
mm.
of people come to us and say like this. So what's your opinion on that and how to break those myths?
Well, you see, the simple answer is that not everybody becomes addicted. Okay, like I explained earlier, some people can drink alcohol and they can stop, but some people have a problem. Or they are predisposed to becoming addicted. That means they already are born with it could be genetic predisposition, it could be a deficiency in their brain, and as a result of that, when they start to use substances, they cannot stop. The substances develop into a need. Now, another good example you mentioned is marijuana. Okay.
Yes.
Now, many seem to have this conception or misconception that marijuana, it's okay to smoke because it's fine. You know, it serves a purpose. It's natural. Now, which is reasonably true because not everyone who smokes marijuana becomes addicted to marijuana. Some people become addicted. Why? Because they have a predisposition. That means they already have a problem with addiction. Some people can smoke and stop. Now, of course, there's such a thing as medical marijuana, which is another thing altogether. So people get confused, you see, marijuana, medical marijuana, or even for the matter, look at some of the opioid-based medication, right?
Yes.
Valium, heroin. These were all used for medicinal purposes, but then people abuse it, and some become dependent on it. Therefore, they become addicted, right? So not everyone can become addicted. Some can stop, some cannot.
Yes, some people are abusing psychiatric drugs also too, as
Yes.
yes. So okay, when someone got addicted, there are also some misconception of the people around him also. So they don't want to take it as a disease, or people used to say once you are addicted, there is no hope for you. So it's also an obstacle for the addicted person to
Mm,
seek help
mm.
or to go for treatment. What do you think about that?
Well, you see, first of all, I mean, when I meet families, right, and they come to us to
Yes.
seek help, first thing I tell them is, look, Addiction is a disease. Okay, you need to understand this. Yeah, just like any other disease, whether it's cancer or hypertension or any other illness, addiction is a disease. If your child or your loved one has hypertension, you have to take him to see a doctor, right? If your child has a heart problem, you have to take him to see a cardio. If your child has an addiction problem, you need to take him to see an addiction specialist. So addiction is a disease. Now, those days or many years ago or maybe before, people used to think it's willpower. Stop, I can stop, why can't you? I can drink and control, why can't you? But the difference is, I can control because I don't have an addiction problem. You cannot control because you have an addiction problem. I don't have diabetes because I don't have a problem. You have diabetes because you're not well. See, so families need to be educated. If you have a loved one who's not well, who's got an addiction problem, as a family member, you can love him or her. You can take care of him very well, but you cannot treat him. You have to take him to the expert to treat him. This is what I would suggest.
Thank you so much. So, what's the importance of social awareness of this? If you want to explain.
Social awareness.
Yes.
Well, I think psychoeducation is very important, educating the public. Okay. Now, there are various models of treating, okay, and we have evolved over the years. We had something called the spiritual model. Those days, many years ago, when people had addiction problem, they thought they were, they had a spirit in them. And they thought they were, they were possessed with the devil, and they need to be, exorcism need to take place. Then they had something called the what do you call the behavioral model, which means you have a problem because you are naughty. You have a problem because your willpower, you're lacking willpower. And of course, then it changed, and now it has become something we call the medical model of treatment, or what we call the abstinence model. Medical model means you're not well. You need medication and you need psychotherapy interventions,
Yes.
right? Now we have something also called the harm reduction model of treatment. Harm reduction means using other substances or other kinds of medication to reduce the effect of the drugs. For example, we use medication for heroin. Those who want to quit heroin, we give them something else to take. Those who want to quit smoking, they have nicotine patches, they have nicotine gum, they have
Mm.
e-vape cigarettes now, right? Those who
Yes.
want to cut alcohol, they have non-alcoholic juices, right?
Yes.
Those who want to cut down amphetamines, unfortunately, there's no harm reduction yet. See, so treatment models have changed over the last decades, and we have to change our approach with treating people as well. So we have to educate the public that, look, as long as you're not willing to accept changes, you're going to struggle. Compare the COVID situation at the moment. Okay,
Yes.
in February and March, when we were shocked with COVID, right? The whole world came to a standstill. I wanted to come to Bangladesh. And remember, we wanted to
Yes.
meet. We
Yes.
wanted to have meetings, right?
Yes. There
And
was
you guys
a
wanted,
program. Yeah. We couldn't
yeah,
arrange
so
it
much of
fully.
problems, right?
Yeah.
And we couldn't meet. Conferences were cancelled. Everything was put on a stop. But we have learned to adapt. Now we have webinars. We have conferences online. We
Yes.
have Zoom meetings, but we're still functioning.
What we didn't
You see?
have think before. Yeah.
Yes, we never had this before.
Yeah.
Before last year, if you asked me to do a training online, I don't know how to do
Yes.
because I can't see the people, I can't see their faces, and I don't know how to talk. But now I'm forced to do it because I have to learn, I have to adapt. So the society also needs to accept and learn that addiction is something that's going to be here forever. And there are new kinds of addictions that's going to come, new kind of substances. And if we want to help to treat them, we need to adapt with the way we treat them. We need to change our approach. Before, even for us in Solace, our main approach was abstinence. Main approach was abstinence. Now we understand that harm reduction can be used for certain kinds of addictions also. So we have also learned to adapt. Yeah, it's something we need to educate the public or the society.
Yes. Thank you so much. We know Solace Asia is Asia's leading drug and alcohol rehab. So, kindly let us know how Solace is working and why it's different from others, and what's the specialty?
Okay, now Why it's different from others? Okay, this is a question everybody will ask. Why are
Yeah.
we special, right? I suppose that what makes us stand out is that we treat patients with a heart, with passion. Many of the clinicians in Solace are in recovery themselves, and professionals who have accreditations and scientific qualifications are also in recovery. All our staff are accredited, of course, and trained in addiction specialty. And we use a very holistic treatment approach. Okay.
Exactly. That's
Now,
what I wanted to mention. Yeah, please.
yeah. So we use a holistic approach. You see, we call this a biological, psychological, social, spiritual disease. There are four elements, yeah, why some people become addicted. Okay. It's not that I pick up a drink today and I drink and I become an addict, alcoholic. No, there are
Yeah.
four reasons. There's a biological reason. Genetically, some people are predisposed, 30 to 50% genetic. Then also, there's something to do with the reward system in the brain. People who have addiction problems have a deficiency in the dopamine or the neurotransmitter. Okay. Then there are biological reasons why people use medication or drugs or painkillers, for example, yeah, for pain management. Then there's a psychological reason, uh, trauma, childhood trauma, abuse, lots of psychological reasons why people use drugs and alcohol to self-medicate or numb the emotion. Then there are social reasons. Social reasons mainly peer pressure. I'm growing up in an environment where everybody is using drugs, so drugs is normal. So the social reasons. Finally, there are spiritual reasons. Spiritual reasons here are more to do with their self-esteem, their values, their lack of confidence, and things like that. So they use substances. So when we treat, we need to have a team who can treat from the biological, psychological, social, and spiritual areas. So we need psychiatrists and doctors for the biological, nutritionists. We need psychologists, counselors, therapists from the psychological perspective. From the social perspective and spiritual perspective, we need a healthy environment, and we need what we call recovery coaches. Recovery coaches are those who are in recovery themselves, have been through the process, and can help others, especially from the spiritual perspective, to boost their self-esteem, their confidence, their values. So we need a holistic approach with a complete holistic team, and that's something that we do in Solace.
Yeah. Thank you so much. Zinia Sharkar have joined with us and she asked, I want to know about Solace Asia's program and treatment outlines. Yeah, already Dr. Prem has shared the treatment outlines, I think so. So yeah, Solace Asia's program, so please.
Well, okay, so there is a very structured program. Okay, so like I said, we have a team of people who work together. Now, every patient who comes, we'll put them through an evaluation. We start with the biopsychosocial evaluation, a lot of questionnaires, a lot of assessments. Now, based on the findings from these evaluations, we will understand the the history of the patient as well as the family history. Okay. Now, once we have that, we will assign a counselor or a psychologist to the patient. The patient will have a group therapy throughout the day, and the patient will also have an individual counselor or therapist who works with him or her throughout the program. Okay. The program is busy. So morning there is group therapy, then there's breakfast, then there is individual therapy, then there's lunch, and then after that there's something we call alternative therapies, yoga, meditation, psychodrama, music therapy, art therapy. So throughout the day, there are activities which are related to the treatment. Okay. Now, every now and then we evaluate their progress. So we will re-evaluate their biopsychosocial assessments. We will have family therapy and family programs as well. And based on the findings, we keep tweaking the treatment to make it specific to their needs. Sometimes we see some trauma-related issues arising, and based on that, we treat the trauma. If there are family-related issues arising, then we treat the family-related issues as well. So it's a constant evaluation and review, evaluation and review.
Thank you so much. Is there any outing when people get admitted there?
Oh yeah, of course, yeah. So now, of course, outings are limited because of the
Yeah,
whole
due to
pandemic. Yeah.
yeah, exactly.
But
Yeah.
normally
Okay.
on the weekends, we take them out for sea sports, mountain climbing, sea activities, a lot of outdoor activities as well. That's very important. We have a swimming pool, we have a gym indoor, and people go swimming. Lots of physical activities as well. Yeah.
Yeah, it's also most important thing. Yeah, thank you so much for sharing. Many people think addiction is always substance based, so but there are also different kind of addiction, as we know, device addiction, porn addiction, sex addiction,
Yeah.
and gambling, like this. So how Solace is working on those as well?
Okay. So generally speaking, you're right, Sabrin. There are two types of main addictions. Okay, one is known as
Yes.
substance addiction, and another one is known as behavioral or process addictions. Okay, now substance addictions or chemical addictions are things like alcohol, cannabis, marijuana, amphetamines, glue sniffing, anything that is chemical related. Uh, Process addictions or behavioral addictions are things which are non-chemical, like gambling addiction, sex addiction, internet addiction, shopping addiction, eating disorders. Okay, these are
Yes.
called process addictions. Now, the specifics of the treatment is different. Okay, so we have a therapist who will work individually with the client on the specifics, but the overall addiction concept is the same. Yeah. So, for example, how does addiction affect your family? How does addiction affect relationship building? How does addiction affect finances? This will be quite the same whether it's substance or gambling. Okay. The difference may be, say, gambling addictions would have more finance or economy related issues, money related problems, right? Alcohol addiction may not have so much of money related issues, but both of them would have family and relationship and trauma related issues. So that's something similar. Yeah. So
Yeah.
we have therapists and clinicians who are trained specifically in various areas, and they will take on the clients depending on the need.
Thank you so much. Mehzabi Mithila has joined with us and commented what will. I'm showing that on screen. What's the duration of treatment in Solace Asia and what is the follow-up procedure after treatment? Do you have any after treatment service or after care service? Yeah.
Okay. You see, treatment, yeah, when we talk about treatment, if you look at most rehabs or especially private rehabs, they would say it's a 28-day program. Now, the reason why it's a 28-day program, and mind you, be careful that it doesn't mean that 28 days is enough to get people into recovery. It's not, yeah. Now, generally, on average, 90 days is a good time frame. 3 months. Okay, 3 months
Yes.
is a good time frame for a person to reach a certain level of stability. Maybe about 50 to 70%. Again, depending on the like I said, biopsychosocial evaluations that we do. Now, the reason why most rehabs or treatment facilities say it's 28 days is because most international insurances pay for 28-day cycle. If you have an insurance policy which covers mental health or a residential treatment, they would pay for 28-day cycles. But on average, I would say a 3-month, 90-day program is what is best to look at. Right? Now, is there a continuity to the program? Yes, there must be. Someone who's got addiction problems, say for 10, 15 years, the amount of problems and the damage that has taken place cannot be sorted within 3 months. It's going to take a long time. And people cannot stay in rehab for 3 years or 4 years. That's not very viable,
Yes.
right? So once residential treatment is completed, there is a follow-up done in aftercare, outpatient. And that's what, for example, in Dhaka, in Bangladesh, Athena does that for us. We have our specialists there. We have Dr. Chauvin there. We have Sabrin there. We have specialists in Dhaka who manage that aftercare component for patients who come from there. For patients who come from other parts of the world, we have aftercare clinics there as well, whether it's Riyadh or Dhaka or Singapore. We have clinics there as well. So aftercare is a very important component. Yes, we have to do that. We do that. We do that.
Yeah. Thank you so much. How important the role of family for the treatment of addiction persons? As you know, you have mentioned already earlier about family workshop. We also have done so. Please.
Okay. Now, as I said, this is called a um, biopsychosocial spiritual disease, right? The
Yes.
psychosocial aspects come from the family. Okay. So the environment people grow up with, the kind of support they get at home, or the kind of support they don't get at home, is an important component of treatment itself. Now, very often we notice patients who come into treatment, the later stages of their addiction, or the last stages, if you want to call it that, before they come into treatment, takes place in their homes. Okay, they
Okay.
become very comfortable to use the drugs at home. The safest place for them sometimes is their toilet or their rooms, because they feel safe. Nobody's going to come into the room. Nobody's going to come to the toilet, right? So
Yes.
the home environment can become conducive for the addiction, not for the recovery, right? And sometimes the relationships at home, the communication at home becomes very distorted because of all the maladaptive behavior, because of the dysfunctions at home. So when we treat someone in, when somebody is in treatment, the family environment needs to be treated as well. It's very important, because if not, you take the sick person from the environment, you treat them, you don't treat the family, you put them back into an untreated family environment, the chances of relapses are very high. You see, so the
Yes.
family members, as much as you love each other, you care for each other, remember that addiction is not a lone disease. It affects the whole family system. The whole family structure needs to be treated as well. Yeah. So part of the treatment process is getting family members involved.
Thank you so much. People usually think that the road towards recovery is more difficult. So, what's your opinion on that? But we know it's a chronic relapsing disease. So people are
Yeah.
more we are anxious about, conscious about relapse. So, please share your opinion on that.
Let's put it this way, okay? Recovery is a process, and you're right. The road is the recovery process is not going to be easy, but the difficulties in recovery is still better than the best times using drugs. Okay, so
Okay.
the difficulties that you face when you're in recovery is going to be better than the highest moments you have had during your addictions, because when you're high you don't feel the damage, but when the next day when the high comes down, that's when you have to face with the reality, the damage you've done to yourself, the damage you've done to your family, the damage you've done to the law, for example, or to the community, to the society. That's the reality that you have to face in recovery. What's the best thing is that when you have a problem, you can still face it without the drugs. Your brain is sane, your mind is clear, you can fix it, you can solve it. So the worst days in recovery is still the better day. The worst days in recovery is still better than the best days using. This is something we say, okay? And it's a chronic relapsing disorder, true. Just like any other disease, like diabetes, it's a relapsing disorder as well, okay? Or hypertension, or any other kind of illness. You have it, you can still live with it, but there are certain rules and regulations you need to comply, right? Lifestyle changes for a diabetic, for example. You tell a diabetic patient, don't take chocolate cake. Don't take fruit cake. But they do.
Yeah.
They do relapse. They don't comply. So sometimes it happens in recovery. But if it happens, you get back on track. You jump back on track again. It's okay.
Yeah, thank you. What's the society role to help the people on the way to recover? As we know, when people uh, come get back from rehab and want to mix up with the society again and start a new life, most of the in Bangladesh actually we are facing this problem. They are poking them. Actually, this is what happened. So, what's the society role here, please?
I think that's not something only in Bangladesh, Sabrina. I think even in Malaysia or Singapore, any other countries, whether it's Southeast Asia or even in the West, we are facing this problem. Um, People struggle to see addictions as a disease. I think the main reason for that is because of the things that people of addiction problem do. They break the law. You know, they have to steal to find money to buy the drugs. They break the law. They drive under the influence of drugs because they can't think, and then things happen. Bad things happen. They go to jail. So the society keeps punishing them, and we
Yes.
have this thing about addicts are people who break the law constantly, and they need to be punished. Therefore, we catch them, we throw them in jail. Now, the thing is, when you throw them in jail, you are punishing the crime they have committed, right? But you have not treated the addiction or the illness that they have, which causes them to commit the crime. So throwing a person suffering from addictions in jail is not the solution. You're punishing the crime, yes, which is right. You break the law, you need to face the consequences. But you still need to treat the addictions. If not, this chap is going to keep going back to jail over and over again. And that's not a solution for the society, or for the person, right? So we need to look at treatment. In fact, now we are talking about prevention more than treatment. We're going into schools, right? We look at
Yes.
kids, 13, 14 years old, we're educating them on addictions, and we want to prevent before they even start using these substances. So the society needs to understand that people who have an addiction problem are ill. They are patients. They're medically or mentally unwell, and they need to be treated.
Thank you so much. What is 12 steps? Would you please brief shortly?
Okay. Now the 12-step program, it's something that was developed in the 1960s, if I'm not mistaken. Okay, it was started by a group of people who are recovering from alcohol. Now, again, those days, as I mentioned, people thought addictions was as a matter of willpower, and you could not stop, and they were not good people, blah blah blah. And there was this misconception. So this group of people got together. People are suffering from alcohol dependency, and they
Yes.
started a small support group. And what they realized was, when they met once a week, they talked about their problems and they shared their views. They realized they started supporting each other, and they realized that supporting each other was helpful for them to grow in recovery. So this group grew. Okay, they grew bigger. More people joined. Then they formed more groups in different communities in America and USA, and then it slowly spread. And what they did was, they thought they needed a guideline, so they started these steps called the 12 steps. The 12-step guideline is a spiritual program. It's not religion, it's not faith-based, but it's spiritual in the sense that it teaches people how to live in life on life's terms. Okay. Now, people with addictions live life on their terms, not life's terms. So they struggle to live life on life's terms. And this 12-step program teaches them values, teaches them self-esteem, teaches them how to respect themselves, and teaches them how to live life on life's terms without the substances. So it's a support group, it's a community support group. It's available throughout the world. Most countries have it. And it's very helpful for people to go as aftercare, especially once they've gone through hospital or rehab or treatment. Going for 12-step meetings is very helpful.
Well, so we would like to know importance of NA or A group and the role of recovery coach as well.
Yeah. So NA, AA, EA, SLA, these are all anonymous groups which develop from the 12-step concept. Okay. Now
Yes.
they are in the community, as I explained, and all these groups started from something called the Alcoholics Anonymous, or AA. Then from there they branch into Narcotics Anonymous, NA. Then they have Eating Disorder Anonymous. Then also they have Sex and Love Addicts Anonymous, Codependence Anonymous. So there are many anonymous groups which are all based on the similar 12-step concept. Okay, available in the community throughout the world. Right now, sometimes there are meetings even in the morning. They call them breakfast meetings. In Singapore, there are quite a few. Even in Kuala Lumpur, there used to be breakfast meetings. You go for a 12-step meeting in the morning at 8 o'clock, and then you go to work. And it feels good. It really feels good about it. Um, they have lunchtime meetings as well, where you go for a lunch talk in the afternoon during your working hours. Then you go to work, and it feels really good about it. Yeah. So these are community support groups available in the community itself. Now, recovery coaching is a different concept. Okay, recovery coaching is something where, as I explained earlier, these are people who have been through treatment themselves, in recovery, and they are trained.
Mhm.
They go through a specific recovery coaching course. They are trained specially, and they become certified recovery coaches. They work in the holistic team, with the doctors, psychiatrists, psychologists, counselors. They support this team. They play a very important role, and they practice the 12-step program a lot. So they come in very handy to introduce 12-step concepts to the patients who are in residential treatment.
Well, thank you so much. We know about the new wings of Solace Asia, the Solace Wellness. So, what is Solace
Hmm.
Wellness and how it's working?
Okay. Now, Solace Wellness was formed mainly during the pandemic, actually. Yeah. What we
Yes.
realized was, yeah, mainly it was during the pandemic. If you remember, Sabrine, there were many patients who wanted to come into treatment. They couldn't fly. The COVID situation caused a lot of stresses for families around the world, and people were locked up together.
Yeah.
Families living together in a confined environment for a long period of time is stressful. We are so used to
Yes.
going to work, traveling outside, coming back, but confined became very stressful. Many people became ill, not only with addictions, but also with other mental health issues as well. So we started receiving calls for people suffering from depression, anxiety, trauma, stresses, and people wanted help. So we started Solace Wellness as an online program initially to support people with online therapy. Okay. And mainly it was online at that point of time. Now, as we developed along, we realized that there was also a need for employee assistance program for big organizations, for companies who had many staff. They wanted support for their
Mhm.
staff as well, because their
Exactly.
staff were feeling the pressures of the COVID and pressures of the stresses of the pandemic, right? So we started an employee assistance program as well. And we got together a group of counselors who do a lot of telephone counseling now, for mainly for employees and companies who need help. So that's under the Solace Wellness program. And of course, we have now a team of counselors who work with us, who provide face to face counseling, telephone counseling, grief and trauma therapy, crisis management for big companies. And Solace Wellness started with that, and we are growing now. It's not only addiction, so now we have moved into mental health as well.
Yeah. Thank you so much. So let's wellness also ensuring service during this pandemic as well as it's now in through online. So great.
Well, we initially started, as I said, as online program. And
Okay.
now in Kuala Lumpur, in Malaysia, people are moving about. So of course, we have our clinic as well in Kuala Lumpur. So we have patients coming into the clinic for face-to-face therapy as well. And like I said, with Solace, initially when we formed Solace 7 years ago, it was addiction specific. But what we realized that there's a need now, especially this year, for people suffering from other diseases, other illnesses, and that's why we have started another team to help with mental illness as well. That's how
Thank you
Solace
so much.
Wellness started.
Yes. So if any international patients wants to come for treatment in Malaysia in KL now in Solace Asia now, so how they will contact? So if you tell me the procedure.
Right. Okay. Now, over the last 5, 6 months, or maybe even more than that, patients couldn't travel. As you are aware, airports are closed. Right.
Yeah.
Now, the Malaysian government, is slowly allowing interstate travel within Malaysia. We are allowed to travel interstate. I believe the international borders will be opening up soon, probably another 2 to 3 months, I pray. But if you want to come to Malaysia now, you can. There is a way of getting approval online. There is a link. I'm not sure if we can share it here, Sabrin. Maybe later you can share it here on this
Yeah.
portal,
Yeah. We will share it here
uh,
later.
where you can apply for a medical visa online. You go online, you submit your application. We will help to support you with documents if you need, and seek approval from the embassy to travel into Malaysia for treatment. Right now, that's a possibility. Next year, I'm hoping things will be easier, but right now there is a possibility, and we already have patients coming in to seek help.
Well, what's the quarantine period? Like 2 weeks quarantine period also will be there. Like we have to stay in hotel.
At this point of time, there still is a quarantine period, so you still need to go through a 2 week quarantine. But what I find actually, yeah, and I want to share this with the public as well. Sometimes this quarantine has actually been helpful. Okay, I have seen patients flying in from abroad. We had a patient who came in from Hong Kong. We had patients who came from, I think, Myanmar or Vietnam, who are from UK, who come here. They want to get well. During this quarantine, it actually helped them to come off their drugs dependency. So before they came, we got them to see our doctors in their home country. They got their medication. They came here. They locked themselves in quarantine. They used the medication. We do online therapy for them daily to guide them. And by the time the quarantine is over, they were completely abstinent of the drugs, which means when they come into Solace for treatment, it's easier for us to work with them on the psychological aspect. So this quarantine may actually be useful to quit the addictions. Just bear that in mind, and I see it happening already.
Yeah, thank you so much. Imran Chaudhary from UAE, at least Dubai, have joined with us, and he asked, in which countries you were running your operation, Solace Asia.
Okay. At this point of time, we are only doing treatment in Malaysia. Residential treatment is only in Malaysia and Kuala Lumpur. Uh, we have partner clinics in other countries as well. Um, I used to go to Dubai quite often, and I enjoyed Dubai very much, I must say. I enjoyed going to Dhaka as well. I think I have an eating problem. I love to eat food, so whenever I travel, I like to eat. Um, so we have partner clinics as well, where we
Okay.
can refer our patients to go back. But residential treatment is solely in Kuala Lumpur at this point of time, only in Malaysia and Dhaka. In Dhaka, we have a hospital. Of course, Athena Hospital is there, where we do the detox and we do the aftercare treatment. But residential treatment at this point of time is only in Malaysia.
Thank you so much. Thank you so much for all for your opinion and for all the important information you were have shared with us. And also, lots of people have joined with us till now. I think people who were seeing all from all over the world who were seeing right us now. So I hope you got much information about addiction and making the taboo around addiction and road to recovery and treatment processes in solaces and all. I think so. If you have anything further to know, you can inbox us. I
Mhm.
hope we can share our contact number and details. And for Malaysians, Visha also, I think Solas also can help for the documentation, right?
Yes, we can. Yes. Just
Yeah.
follow the link, fill it up, and then let us know what documentation you need, and we will help you with it. That's not a problem at all.
Yeah, thank you so much. So we are
You're most
almost
welcome.
at the end of the show. So yeah, Dr. Prem, at the end of the show, please, if you have any good wishes for us, for Bangladeshi people to get rid of this COVID situation, and also Radio Aamar 88.4 FM, the one of the best leading radio station of Bangladesh. They have arranged this program, and the best wishes for them, and also Athena. Yeah, please.
Okay. Well, as far as the COVID situation and the pandemic is concerned, I think, there's something that we were all shocked with initially, right? The whole world was shocked. We thought we couldn't manage it. We thought we couldn't survive. But we must remember, human beings, we have evolved over millions of years, hundreds of thousands of years, okay? Thousands of years. And we have evolved because we are highly adaptable. And that is a trait that we have as human beings. And we will continue to grow, we'll continue to adapt, we'll continue to evolve, and we will survive. That's something we need to remember. um, Comply with the SOP. That's the key thing. There are fantastic scientists, researchers out there who are advising us what to do, what not to do. Please comply with that. That's the first thing. The next thing is that, I'm seeing now, during this pandemic, there are so many wonderful people out there who have become so kind and so empathic, and so human beings have become better to each other. you know
Yeah.
we're beginning to take care of each other better than we used to before. So when there's a crisis, we get together. That's the beauty of human nature. When there's a pandemic, there's a crisis, we get together and we help and we grow. I think that's something we need to appreciate ourselves, and tap our shoulders for that. um, and as
Yeah.
far as thank you, Radio Amar, for organizing this, and Sabrin and Athena. You guys have been wonderful partners with Solace, and I foresee that in the next 1 or 2 months the borders, pray, will open up, and we're happy to work with you guys and looking forward to coming over there for
Yeah.
the fantastic food and hospitality, of course.
Sure, sure. Yeah, inshallah. Yeah, we are also looking forward toward that. Thank you so much. Thanks for joining with
Thank
us.
you.
Thanks for your valuable time. Yeah.
Thank you. Thanks, Sabrin. Thank you.
Okay.
Bye bye.
Yeah. Bye bye. তো দর্শক, আপনারা এতক্ষণ আমাদের সাথে ছিলেন। আপনারা আহ, আজকে আমরা যেটা নিয়ে কথা বলেছি আসলে অ্যাডিকশন, যেটা হচ্ছে আসক্তি। এই আসক্তির নিয়ে আমাদের যে ট্যাবু আছে এবং এর পাশে যে আমরা কিভাবে এই ট্যাবু গুলো ভাঙতে পারি, লটস অফ মিথস অ্যান্ড মিসকনসেপশন কিভাবে ভাঙতে পারি, এবং তার যে রোড টু রিকভারি অ্যান্ড ওয়ে অফ ট্রিটমেন্ট, আজকে ডক্টর আমাদের সঙ্গে আলোচনা করেছেন, এবং কিভাবে সোলাস এশিয়া একটা ইন্টারন্যাশনাল ডিআইডিকশন ট্রিটমেন্ট সেন্টার যেটা মালয়েশিয়াতে অবস্থিত, সেটার কিভাবে কাজ করে যাচ্ছে এবং সবার মাঝে চেঞ্জ নিয়ে আসছে, সেই বিষয়ে আসলে আজকে আমাদের আলোচনা ছিল। তো হোপফুলি সবাই আজকের এই যে ইনফরমেটিভ যেই সেশনটা আজকে আমরা কন্টিনিউ করেছি, লাইভ সেশনটা সবার খুব কাজে লেগেছে, এবং এই পরামর্শগুলো থেকে আশা করছি আপনারা কিছুটা হলেও আপনাদের উপকার হবে। তো সবাই খুব ভালো থাকবেন, সুস্থ থাকবেন, ইনশাল্লাহ নেক্সট যে কোনো শোতে আবার আপনাদের সঙ্গে দেখা হবে। আসসালামু আলাইকুম।